and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency servicing Palm Beach County, Broward, and Miami-Dade. You can reach us directly at 954-717-7027. I am your host, Louise Gomez, and I would like to welcome to the show. Today we have Dr. Scott Sobieraj, who is a cardiologist, and he could be reached at 561-365-3000, and that is part of the NYU Langone in West Palm Beach. And the website is www.nyulangone.org. And they have offices right here at 101 North Clematis, Suite 110 in West Palm Beach, Florida 33401, as well as 16244 South Military Trail, Building 500, Suite 560, Delray Beach, Florida 33484. Thank you so much for coming to the show, Dr. Sobieraj, and taking time out of your busy schedule.
Well, thank you for having me.
We know you're very busy being a cardiologist. How long have you been? Tell us a little bit about your background. Where did you go to school, and when did you decide cardiology?
I've been a cardiologist for about 11 and a half years at this point, but I've only been down here in Florida for about 4 months.
Oh, okay, recent.
So
4 months.
A recent move. Previous to this, I was in Buffalo, New York for 10 years.
Okay.
So it's a big move.
Okay. How do you like it so far?
Not, this time of year is nice.
Okay.
We moved in August,
so
it was a little bit much. So I did my undergraduate training at the University of Buffalo.
Nice.
And then medical school as well at the University of Buffalo.
Okay.
Residency at the University of Buffalo, but then I went to Connecticut for fellowship at Danbury Hospital and through Yale University.
Okay.
Afterwards, I went back home to Buffalo to practice for a while, and for family reasons, we moved down here.
Right. Nice.
Now, why I became a cardiologist.
Yes.
When I was 3, my father had an aortic dissection, which is a tearing of the aorta, which is, once it starts to tear, is not very survivable, but luckily for us, he did survive after very brave surgeons went through 11 hours of surgery with him.
Wow. Is that genetic, or is that something that just happens?
It can be. It can be from a few different things. It can be from strenuous activity, like lifting something too heavy. It can be genetic, so it can be from a few different things. And obviously at 3, I didn't know much about what was going on, but
scary.
He needed a valve replacement when he had that surgery done. When I was a freshman in high school, he had an infection on his valve, and it needed to be replaced urgently. His doctor told him, go to Cleveland Clinic. That's where I would have it done. The whole family went. I was taken out of school. We all went down there, and they took us step by step through the whole process. We saw the cardiologist, the anesthesiologist, the surgeon. They showed us pictures of what was going to happen, and they went through all this.
So your parents really involved you in
Definitely.
that. I like that.
And being in biology class at the time, seeing all this, I'm like, this is great. I want to be a cardiologist.
Wow. You knew your calling at a young age.
It
That's
doesn't
amazing.
always work out that way, but it happened to work out in my case that I was able to actually achieve that. So I had a passion for cardiology. The first job I took was actually working with my father's cardiologist.
Wow.
So it's it's been fulfilling.
That's amazing. So back then, that surgery took 11 hours. What would it take today? Because of technology and so much has changed, right?
Interestingly, they do similar things with the surgery at this point.
Really?
You don't want it to rupture is really what it comes down to.
Right.
So once it starts tearing, it's a lot harder to survive.
Yeah.
So ideally, you want to check on the aorta beforehand, get it scanned properly, and if it gets to a certain size, fix it before it starts tearing.
Oh, yeah.
That type of surgery is very survivable. People have good outcomes with that. Once it tears, it's still a long and difficult to survive surgery.
Wow. So we have a lot of listeners right now, and I would like for you, if you can speak into a little bit about when does somebody say, you know, I think I need to see a cardiologist? Like what maybe presents where you're kind of thinking, I don't know what to do. What would you tell our audience?
Well, I would say at a younger age, what tends to get people to come to me is usually I feel my heart racing, I feel palpitations, you know, I'm doing activity and for some reason I can't do it, and you know, it's more because younger people tend to blow things off.
Right.
And so it tends to be something that's very different than their normal activities. You know, they have to stop what they're doing and say, well, I need to see a cardiologist. Right. As patients get older and they start seeing friends of theirs get sick, they see their family members get sick, they tend to be a little bit more proactive about their hearts. But then as you get older, it's more of, I'm getting chest pains when I do activities. I'm more short of breath than I should be. My legs are swelling. You know, things like that, which are usually the impetus for the visit.
Right. So does one need to have a referral to see you, or can someone come in right away and see you if they feel they need to? Or?
It depends on the insurance.
Okay.
Some people's insurance doesn't require a referral. I would say most primary care doctors are more than happy to refer a patient to a cardiologist because they have a lot on their plate, and if it's something that they know that a cardiologist can handle more efficiently, they are more than willing to do that.
And they could call your office as well and they could tell you, look, I have this insurance, can I just go straight to
Yep, and you can even go onto the website and schedule appointments on the website as well. So there's a form for that, and it will tell you the times that are available.
Nice. So you mentioned a word, you said something about preventative. What can we do as, you know, we live in Florida, we like to be out, we like to be active. What do you think is a good prevention or a good way to maintain a healthy heart? What would you say to someone maybe my age, 50-something?
Well, there's the typical things that you know are healthy for you, but aren't the most fun things to do or the tastiest things to do.
Yeah.
So obviously aerobic exercise is better than something like weightlifting. So by aerobic exercise, we mean walking, jogging, bicycling, swimming, anything that raises the heart rate up to a certain level, maintains it for 20 to 30 minutes, and you do that about 5 times per week if you can, every day if you can, but 5 times a week at least. And eating a healthy diet, obviously, which is difficult to do even when you're in Florida and there's fresh fruit and fresh vegetables and fresh fish.
Right.
There's also a lot of restaurants and fried foods and whatnot. And you can get some healthy food at restaurants, but you have to be discerning to do that. So the healthier diet tends to be the Mediterranean diet. And we tell people fresh fruits and vegetables, fish, not fried, but baked or grilled. Very little red meat. If you have to,
like how many times a month or a week, or what would you say?
Mediterranean diet says red meat once a month.
Okay.
If you were to eat meat, they suggest poultry that's lean, so the skin taken off or the fat trimmed off when you eat that. But then again, that should be baked or grilled. It should not be sautéed or smothered in cheese. We do need things like dairy. We do need things like carbohydrates, but dairy should be more skim milk. Carbohydrates should be more multi-grain or whole grain rather than white bread or potatoes. Potatoes
Sure.
aren't particularly great for your blood sugar, so that is, things like long grain rice would be better, or quinoa tend to be better. And it's we all know the foods that are good for us.
Absolutely,
but
right?
It's hard to do that.
It's the lifestyle that we have
It is, and life happens.
Sure.
And we're always busy with something else. Family members to tend to, tired from work.
Yeah.
So it's difficult to do, but some people need a scare in their life to let that happen. But we try to get people to take care of that before they get the scare, because sometimes that's too late.
Yeah, but that is a good point. Sometimes having that little it kind of gets you on your toes, like, okay, I got to do this.
I would say the other thing that people should do, and a lot of times younger people don't do, is actually see your doctor regularly. Doesn't have to be a cardiologist, but a primary care physician, because a lot of younger patients say, I feel great, why do I need to see a doctor?
Right.
And what they don't understand is sometimes there's a process going on inside that isn't causing symptoms yet, but can cause sometimes drastic symptoms as the first symptom. And there's genetic components to that, and they may not know that. They may not know, or they may say, oh, well, my father had a heart attack, but he was a smoker and I'm not. Maybe the smoking did contribute, but maybe there's a genetic component as well.
True, and it's true. A lot of times you're young, you're healthy, you go into the gym, you think you're eating okay. I'm not going to see a doctor. But no, we get to really remind everybody, especially the younger people, get your baseline, whatever it is that you need to test, right?
Definitely, and there is always an inherent opposition to taking medications.
Right.
Everybody says, well, I'd rather not take medications, and obviously eating healthy and exercising can help push that back. But if there's a genetic component to what is going on, all that does is delay what is going to happen, not necessarily stop it. So if your doctor says you really need to be on this medication, very much consider the medication. We don't make money off of giving medications, so it's important that we instill trust in you, that you understand that what we're saying is because we want you to be around for a long time.
Absolutely. Dr. Sobieraj, what do you find that most people that are coming to see you, what are they presenting with? Is there anything that stands out to you that you're noticing, any trends?
It depends. It tends to go in waves, interestingly enough. Sometimes there's a week where I see a lot of chest discomfort patients. Sometimes there's palpitations. Sometimes I do see a fair amount of heart failure patients. And so it goes in waves, but I do see quite a few people who come in and saying, my father had a heart attack at 50 and now I'm 51 and I want to do something to not have that happen to me. So I do see a fair amount of that, probably more here than I did back in Buffalo.
Oh, okay.
And I think part of that is people want to be here so that they can be active longer. Right. And so they have an interest to do that.
So my question to you would be, well, we have a commercial break, so I'm going to hold that question and we'll come right back and I'm going to ask you about that.
All right.
All right. So quick commercial break, everybody. We will be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thank you for tuning back in. We are with Dr. Sobieraj, who is a cardiologist, and you can reach him directly at 561-365-3000 right here at it's NYU Langone in West Palm Beach. And there's 2 locations, one in West Palm, and there's one also in Delray. So you can get the information when you call in. And so, Dr. Sobieraj, we were discussing, like, if a patient comes in, they say, my dad had a heart attack at 50, I'm 50. What do we do? Like, are there any tests, or what would you tell that person?
Well, typically we want to run down the normal blood work that we should be doing, the cholesterol lab work, make sure their kidneys are functioning well, make sure that everything else looks stable, and tell people to do the normal things that they would do, and we would tell every patient to do.
Right.
But if there's a particular family history, as I tell people, there's family history and family history. Family history is what happened in your family, but certain family history is what contributes to your risk. So we say a first-degree relative, so father, brother, grandfather who had an event, a cardiac event before the age of 50, or a female first-degree relative before the age of 60, that is a higher risk for the patient.
Right.
So what we tend to do is there's a test, especially if it's a coronary disease risk, there's a test called the CT calcium score.
Okay.
Which is a low-dose CAT scan that looks for calcium within the coronary arteries.
Oh, that's interesting.
Yeah,
so
and
is it calcium deposits that would get in there?
Well, what tends to happen is the longer that cholesterol plaque is sitting in the arteries, it turns to calcium.
I see.
And it's not a diagnostic test, it's a prognostic test. So it tells you what is the risk of me having a heart attack within the next X amount of years.
I see.
And they give you a number, and then they give you a percentile, which matches you to other people who are of the same sex and in the same age range, and they will say you're in the 50th percentile or 80th percentile, which gives us a guide to how aggressive we should be with risk factors. More recently, they've been looking into some of these other laboratory values. There's one in particular called lipoprotein A, which is a cholesterol blood test, but it seems that genetically it's either high or it's normal.
Okay.
And if it's high, it might double the risk of cardiac events. And to this point, we don't have medications that target that, so we only check it once.
I see.
But there are medications that are in the near future that are actually meant to target that, and hopefully they actually lower events as well. So if your lipoprotein A is high, we would be more aggressive with the management at this point. But otherwise, if it's a heart failure risk, we might need to do genetic testing. If it's an arrhythmia risk, it's difficult to determine if that's genetic. Obviously, if there's sudden cardiac death at in young patients, so somebody's father passed away in their 20s from sudden cardiac death, there's a lot more testing that needs to be done fairly urgently to make sure that that hasn't been passed down genetically.
Now, there's so much technology I see that's changing all the time as far as in the cardiology field. What do they have any new exciting technology maybe for surgery, or I know they're talking about robots. I had another doctor was saying they had robots for the spine.
Well, they do use robots, and they're trying to do things more minimally invasive.
I like that.
And with devices smaller, or put through, the groin rather than cutting somebody's chest open. The emerging standard of care for replacing an aortic valve is actually through a catheter. It used to be only for the highest risk patients, and now even what we would consider intermediate risk patients now could have the catheter-based valves. Obviously, if you're younger, we want the more durable, longer lasting valves, but it's a way to get somebody feeling better without making them go through the whole surgical recovery.
Nice.
They're working on pacemaker batteries that are smaller and last longer. So now your typical pacemaker will last potentially 13, 14 years, where even 10 years ago it was maybe 9 or 10 years. And when it comes to surviving a heart attack, it's interesting how that came about, because before we had angiograms and stents, even if you made the hospital, there might be up to a 50% chance that you actually don't survive that heart attack.
Yeah.
Now with angiograms, stenting, clot busting medications, if you make the hospital, there's about a 98% chance that you're going to survive. But if you don't make the hospital, it's still a 50-50 shot. Which is why it's important, if you think you might be having a heart attack, you need to call 911. And the reason why people like to say, I don't want the ambulance to come here, I'll have my family member drive me. The biggest issue with that is, what if you were to pass out or have a problem? What would your family member do? They aren't going to stop the car and do chest compressions on you, because that probably isn't going to go well.
Good point.
So the best thing to do is go in the ambulance, because they will be able to treat you if something happens worse on the way to the hospital.
Please tell us, what are the signs and symptoms? I heard the highest rate for heart attacks on Monday mornings. That's what I heard. I don't know if that was a rumor.
Well, yeah, I mean,
that's what
Monday mornings are pretty
Monday
stressful.
mornings, kind of like
the morning time is definitely the highest risk of heart attacks.
Really?
Actually, right before people tend to wake up into mid-morning is when most heart attacks do happen. It has to do with the circadian rhythms, the cortisol levels changing in the body, waking up, meaning the blood pressure is getting a little bit higher, the heart rates are getting a bit higher. Doesn't mean you can't have a heart attack at 8 o'clock at night or midnight or anything like that, but it is a little bit more often that that's the case. And for men and women is a little bit different.
I was going to ask, can you please go into that, so our audience, if they're listening and they have a family members going, if they see that, so they'll be alert. So what would be the signs and symptoms of somebody having that?
The textbook definition of symptoms of a heart problem, especially a heart attack, is heaviness in the chest. Usually if somebody says, I have an elephant on my chest, or somebody's standing on my chest, that is typical. Radiating up to the jaw on the left side, left shoulder, and down the arm, potentially tingling in the arm. Breaking into a cold sweat and being short of breath. The reason why I say it's different for men and women is, for a long time, women were actually undertreated when it came to heart disease.
Really?
Because it turns out women may not have all of those symptoms. They may have one or even none of those. They may say, I feel fatigued, or I had that flu the other week and then I got better, and it actually may have been a heart attack. So it may be more subtle. Patients with diabetes are the same way, because sometimes diabetes lessens the nerve action, so it's less likely that they get the actual chest discomfort. So we have to be mindful of that. So it's, if you don't feel the same, or I used to be able to do this and now I can't, it's worthwhile getting evaluated. Obviously, if something suddenly happens, or you're suddenly short of breath, or you're suddenly having chest discomfort, you need to call 911 because something is likely happening right now.
Absolutely. So Dr. Sobieraj, we have 2 minutes left. What would you like to share with our audience? Any last minute tips or advice or whatever you'd like to share? Feel-good story. We got those 2 minutes.
Yeah, I would just say to everybody, don't be afraid of us. We're usually nice people. And we usually have what's in your best interest in our hearts as well, because we feel better when our patients do better.
Absolutely.
And I think that while you may not want to take medications or have tests done.
Right.
Usually we choose the tests that are best for you being around the longest, because
Yeah.
I tell a lot of my patients, especially as they get older,
Right.
most people don't want to live forever if they're not feeling well.
That's right.
So what we want to do is make you live as long as you can, as well as you can.
Absolutely.
And a lot of that has to do with catching things before it's a problem.
Quality of life.
Quality of life is always the most important thing.
Absolutely.
And if our medications cause lower quality of life, we're willing to work with you to find the best compromise.
Thank you. We appreciate that. Thank you, everybody, for tuning in. We had a great interview today with Dr. Sobieraj. You can reach him at 561-365-3000. We are at All County Healthcare. Please give us a call. We're a certified home health care agency servicing Palm Beach County, Broward, and Miami-Dade. You can reach us at 954-717-7027. Thank you, everybody. Until next time, have a great night. Take care.